ഈ പി സി ഒ ഡി മെന്റൽ ഹെൽത്തും വളരെയധികം കണക്റ്റഡ് ആയിട്ടുള്ള കാര്യമാണ്. അതിൽ വരുന്ന ഹോർമോൺ ഫ്ലക്ച്വേഷൻ ഞാനെല്ലാ
ആണ്. ഞാൻ ഒരു കാര്യം ചോദിക്കട്ടെ? ഈ പി സി ഒ ഡി ഉണ്ടായാല് കുട്ടികളില്ല എന്ന് പറയുന്നത് സത്യമാണോ?
സത്യമാണോ എന്ന് ചോദിച്ചാൽ സയന്റിഫിക്കലി ഇപ്പൊ നമുക്ക് അറിയണമെന്നുണ്ടെങ്കിൽ അറിവുള്ളവർക്ക് ചോദിക്കും. പക്ഷെ ചിലര് പറയും ഉണ്ടെന്ന്, ചിലര് പറയും കുഴപ്പമില്ലാന്ന്. പക്ഷേ കുറച്ചുകൂടി ബെറ്റർ ആയിട്ട് അറിയണമെന്ന് ചോദിച്ചാൽ നമുക്ക് വ്യക്തമായിട്ട്
അപ്പൊ നമ്മളിതറിയാൻ ആരോട് ചോദിക്കുന്നു?
നമുക്കൊരു കാര്യം പറയും, നമുക്ക് വിദേശ ഡോക്ടർ
അത് നല്ലൊരു ഐഡിയ അല്ലേ?
ആളെ നമുക്ക് അതിനെ കോളേജ് ചെയ്തുകൊണ്ട് കാര്യങ്ങളൊക്കെ അറിയാം.
അതൊന്ന് ചോദിച്ചു നോക്കാം.
Hey everyone, International Women's Health Day is observed on May 28th every year. Actually, it's a global initiative to raise more awareness about women's health and also gender equality, and it also advocates women for better healthcare policies and agencies for health.
The aim of the day is to highlight women's health care concerning such as reproductive health and maternal mortality, and access to health care and promote gender-sensitive health care, and also for empowering the women to control their health and well-being.
So today we are going to conduct a discussion talk to clarify the myths and to know more about women's sexual hygiene with
Dr. Nidesh from Gynecologist Department, Sri Abhinava Vidyatirtha Multi-Speciality Hospital, Sringeri.
excuse me. Sir, I'm Sanju Sadish, final year BSc Nursing student from Sharada Nursing Institute.
I'm Nandana K from 4th year BSc Nursing, Sharada Nursing Institute.
Actually, we came for an interview with you to know more about sexual and reproductive health of women. So, can we start, sir?
Yes, we can start.
Good evening, sir. Nowadays, in society, a broad range of issues related to sexuality, reproduction, and it also includes maternal and child health. So, can you share your view about sexual and reproductive health of women?
See, sexual and reproductive health, it should be started in the initial phase of your studies only. In my opinion, you have to start it from the higher middle class, or from 7th or 8th standard only you have to start. You have to get the knowledge of menstrual cycles, menstruation, and what is the puberty, how the secondary sexual characters develops in the male, female. It should be discussed with both sitting both of them. See, during my childhood days, what it has to happen is whatever the male reproductive system to study with or male secondary sexual characters which was there, they used to tell in the whole of the class, sitting both girls as well as the boys. But after, when it comes to menstrual cycles and all, they used to send us to the outside. They just teach only to the girls. So during when I was in 7th or 8th standard, it was like that. But now I don't know. The system has been changed. But everyone should know what all the things is going on. Means boys should know about the girls' menstrual cycles as well as the secondary sexual characters, as well as girls should be aware of the boys' secondary sexual characters. That is what it should be. And for that, they can make another best thing is they can make any doctors to come and talk about this thing. Say taking some special classes with the doctors, what is their opinion, how you have to change your mindset regarding the reproduction as well as the sexual health. That is what my opinion is. It should be spread in a whole knowledge. Okay.
So actually we know India is a developmental country, but also certain group of the peoples lacking sex education, limited access to contraception, and socio-economic factors. So, can you share your experience or insight about the teenage pregnancies?
Teenage pregnancy, actually, if I consider it as in a North India as well as South India, what actually I studied from AIMS Delhi. So what I have seen in Rajasthan as well as the Delhi part, their literature rate is too less there in that states. Okay, and even though now teenage pregnancies is going on, sometimes child marriage is also going on. So many patients were coming at 17, 18 years only with the pregnancies. So in there, they have made that as a culture, and they have thought that when she start the menstruation at age of 15 or 16 years, she is capable of producing reproduction. Means she is capable of bearing a child. But actual part is it is not true. So, actual part to gain the pregnancy or to gain or you become a married couple, it should be certain amount of the age difference should be there. Means a girl should get a matured way. That is why the government of India had made a rules of boys of 18 years, sorry, boys of 21 years, girls as a 18 years as a marriage age. So after by that change age, we'll get the knowledge as well as the maturity in their hormone level as well. So that is the why you can get into a pregnancy. If you get as a teenage pregnancy, there will be more complications to the mother as well as the developing baby as well. So it should not happen actually. So, but the true fact is, in the northern states, some or the other time it's happening in a culture way, but now it is in reducing manner. There also they are more of a literacy rate is going on. People are getting knowledgeable. There also it is getting towards the lesser side, but the practice is still going on there, and they should get a awareness and they should get the proper education about that. See, there are most of the village people, even boys doesn't know about the girls reproduction as well as girls doesn't know about the boys reproduction. And some of the any intimation can happen between boys and girls, and this may lead to a illegal child, getting a illegal kind of childness. Okay, so there should be sexual education should be given to all of them. Okay, they have to be planned and they have to be known about what is the actual things going on, and after that only you have to get into proper treatment as well. So according to me, teenage pregnancy is not a good kind of thing. Means you have to get a certain amount of age, like about 20 years. So after 20 years, if you are capable of reproduction, then you can able to conceive a child. But before that, it is an health issue for both growing mother as well as to the fetus also. So I am against to the teenage pregnancy, and I am against to the overburden of the age also. Means elderly pregnancy is also not good. If you are conceiving at 40, 35 years above also, that is also not a good thing. That is happening in the South Indians actually. See, the elderly means most of them are busy with their work, like IT professional or any other work. They are now getting marriages in their late 30s or 35 ages. So if you are married at 35 age and conceiving at 38 to 39, so there is a chances that they are going for the infertility treatment. So at a proper age, they have to get a married and get a conceived. If the proper age is 25 to 30 to 35, that is the maximum.
Um, the cervical cancer and the breast cancers are two significant health concerns affecting women worldwide. So there are several myths about cervical and breast cancers. So can you please share common myths about cervical and breast cancers?
Yes. See, words means according in the women's group, the first most common cancer is the breast cancer. The next common cancer is the cervical cancer. Only I am talking with the woman part. Okay. Breast cancer, you should be aware by the teenage itself. Means breast cancer, it is not that cancer won't happen, won't run in the families. Sometimes cancer runs in the family, sometimes cancer won't runs in the families. Means sometimes genetic history will be there. No, not a genetic history may not be there. So, for that concern, for every woman after the age of secondary sexual characters, like age of 15 to 16 years, when they get their fully developed breast, they should examine by themselves. They should examine by themselves. Means every 3 months or any some 6 months, they should get any, if any lump or any palpable tissue or any lump you can feel, they have to consult to the, they have to go to the consultants or any surgeon, or any opinion should be taken. Means the before the cancer grows in a advanced stage, it will emerge as a small lumps in the breast. In the early stage, if it is a normal lump, you can remove it off, but never neglect any small lumps or any palpable lump in the breast tissue, especially the young girls. Okay, they should not concern of that. Coming to the cervical cancer, it is the second most common from the breast cancer. See, cervical cancer, it has many causative factors. There are many factors about this. So, cervical cancer, it usually comes at the age of 40, above 40 years. But what the girl can take a care of, means how she can be protected of. One thing is, there is vaccinations are available as of now. See, cervical cancer vaccinations already, it has been there and it is present whole of the world. The vaccination idea should be given to all of the teenagers. Means the vaccination start, you can take vaccination start from the 9 years to 14 years only, like how you are taking the OPV, herpes, or any other vaccination, hepatitis, and all you are taking. So that time only, by 9 to 14 years only, you can take the vaccinations. It is a costly drug, but you can share among yourself. It will one vial cost around 14,000 to 15,000. So one girl can't afford that much. Okay. So by awareing yourself or by taking the knowledge from the doctors or from your surroundings, you can take that vaccination. It can be 2 doses, 1 month apart. 2 doses will be there, and you can take from start from 9 years to 14 years only. Suppose you are not at that age, you are not able to take, you can extend that vaccination to 25 years also. Now also you can take that vaccinations. And other risk factors is early marriages. Getting early marriages is also one of the important thing. Means as the age, if you delay the marriage, there is the low risk of getting cervical cancers. If you come to sexual contact in early ages, at the 15 to 18 years or 18 to 19 years, there is high chances of getting cervical cancers. Okay. And having multiple sexual partners. So now the trend is going like one marriage, divorce, another marriage, like 2 husbands, 3 husbands. There will be some multiple sexual partners. Even though they are normal, they are healthy, if they have these kind of multiple sexual partners, or for example, even sex care workers also, so they are all prone for the cervical cancers, and they should be screened at particular age, like 25 years afterwards. They should be get a consultant opinion, and they get a regular checkup every 3 yearly or 5 yearly.
The sex-related mindset of the Indian peoples is complex and diverse. It may be influenced by social, cultural, and historical factors. Sex is often concerning as taboo topic. It may get difficulty to openly discuss. Uh, so how do cultural and social norms influence access to contraception?
Uh, if you are talking about contraception, especially in Indian setup, we are talking of the reality in India, what we are dealing with right now. See, the contraception comes only after you are getting an 2 or 3 child only. Now the Indian setup or Indian mindset, what there is, contraception means stoppage of the pregnancy. Once you want to stop the pregnancy, means first you have to get 1 or 2 times pregnant and get a healthy child, and after that you have to stop the pregnancy. That is why the Indian people are okay. It is not that in the initial phase only they have to get a contraception, means they are not in that manner. Okay. But if you go to other like USA or Britain state, they are already started contraception in their early age, 15 to 18 years, because there the sexual activity start by age of 15 only. So all girls are become sexually active by 15 years. Here there is a age limit of 21, 22 years thereafter, but there it is an early sexual things are there. But for there will be contraceptions. They are starting early only. So there are many types of contraceptions we have. Contraceptions like we can take a oral pills. Oral pills is the one of the option, and you can take intrauterine contraceptions. You can take on injections also. Whatever you take the pills, it will be given in a injection also. Okay, and other things are putting a contraception to the intrauterine. Means any sexual organ is there, you will put a contraception into there, copper T or any marina, it will be there. So those kind of things, whatever the invasive procedure, putting the any contraception to the cavity or uterine cavity, they should be married first of all, and they should lose their virginity first, and after that they should have some one or two child. Then only they can opt those kind of thing in India, especially talking in India. But like for teenagers who are not don't want any pregnancy, they can opt for oral contraceptive pills. Pills are available now, so they can take that. But it should not be in a frequent manner, because it has its own side effects also. Yeah, like gaining weight gain, heart disease, getting early hypertension, diabetes. Those kind of issues are there with the tablets because they are hormonal. So if you are planning to get a contraception way, so you should take a contraception in a planned manner. For teenagers, it should be oral or it should be injection wise. For who are already married and got the child, they can put the intrauterine contraceptions.
So we heard that in certain cases like late pregnancies and also the woman who is under fertility treatments has the chances of getting twin babies. Is that truth or any fact behind that?
So you are basically talking about how the twins happening.
Yes. In some cases we heard that like late pregnancies are most common.
Common for twin
Twin
pregnancy. So no. It is actually it's a misconception. Late pregnancy won't cause twins. Twin pregnancy, the causation of multiple pregnancy means twins or triplets. It may be familial, means her grandparents or her father, mother, who has the history of twin pregnancy, they will run with the family. One thing, and one more thing here is after older ages like 30, 35 ages, you will lose your quality of ovum to reproduce. Means there the chances of getting pregnancy is only little low. So those people, what they will do is they come for the treatment. So by treatment, they will get a chances of multiple pregnancy, like twins or triplet pregnancy. It is not the age related thing. It is because of the treatment they may go for multiple pregnancy. Okay.
Thank you. Sir, nowadays PCOD or polycystic ovarian disease is major concern for women. There are several myths and doubt related to PCOD. The most or common asked questions is how does PCOD affect the fertility?
Uh, for example, how does PCOD affecting the fertility? See, PCOD is it is actually called as PCOS. It is a syndrome, polycystic ovarian syndrome. It is not a disease, actually. See, syndrome means it's a group of disease. Means it doesn't have only one causative factor. Because of one factor, it has came to you. It is not like that. See, for example, if you get any fever or any bacterial infection, it is because of bacteria you got that infection. But here PCOS, it is not an one factor. It is a multifactorial. Means by teenagers, if you are not modified your lifestyle properly in a proper manner, there is high chances you will get as a PCOS. Okay, how it will get if you are means not taking healthy foods. One thing, if you are too much stressed, one thing, and if you are taking more of an hormonal tablets, not doing regular exercises, and not concern about yourself, means your health only, and for every other things it will first affect your menstrual cycle. means you are getting a cycles like not in a every monthly, you are getting it in a 3 months or 4 months like that. Okay, so how does it affects the infertility means, see, for fertility means to conceive a child you should have regular periods. If you have regular periods means you are ovulating, means your ovum is exposed to the sperm in future. But if in PCOS what happens is you are not ovulating frequently, means you are in no periods only affected. You are getting 3 months or 4 months once period means your periods is not proper and you are not ovulating in a proper way. So that time the ovum will not be exposed to the sperms. So that is why infertility will happen. If you get, so it is not that all the PCOS get affected by the infertility. See, many patients with PCOS getting the regular cycle by altering their lifestyle habits, they have conceived. But who are not getting regular cycles, they are affected. So what we treat them to get the regular cycles by modifying their lifestyle as well as by tablets. And tablets is also not much good also. Okay. So after that, if they get regular cycles, then they can plan for the pregnancy and they will get a conception.
Thank you, sir. Actually, your questions are over.
Huh.
Thank you for cooperating with us.
Okay.
And you are
അപ്പൊ നിന്റെ ഡൗട്ട് എല്ലാം ക്ലിയർ ആയി സാർ എന്നിട്ട് എക്സ്പ്ലെയിൻ ചെയ്തല്ലേ നിങ്ങളുടെ ഡൗട്ട് ക്ലിയർ ആയോ?
ക്ലിയർ ആയി എന്നാണ് വിചാരിക്കുന്നു.
താങ്ക് യു. നമ്മുടെ ഈ അവയർനെസ് പ്രോഗ്രാമിന്റെ ഭാഗമായിട്ട് ഇതിൽ പാർട്ടിസിപ്പേറ്റ് ചെയ്യാൻ പറ്റാത്തവർക്കായി നമ്മൾ ഈ വീഡിയോ അപ്ലോഡ് ചെയ്യാനായിട്ട് ഉദ്ദേശിക്കുന്നുണ്ട്. അതിന്റെ ലിങ്ക് ഒന്നുകിൽ നമ്മളുടെ അക്കൗണ്ട് ബയോയിൽ നിന്നോ അല്ലെങ്കിൽ സ്റ്റോറി ഹൈലൈറ്റ്സിലോ നമ്മൾ കൊടുക്കും. താല്പര്യമുള്ളവർക്ക് അതിൽ കയറി കാണാവുന്നതാണ്.